Welcome to the Micromolar Podcast, Health and Wellness Series.
Today we're diving into an important topic, especially for older adults and those who care for them: human frailty, how clinicians test for it, and what can be done about it.
This is such a relevant conversation. As our population ages, identifying and addressing frailty early can genuinely make a difference in someone's long-term independence.
Let's start with assessment. So, how do clinicians actually test for frailty?
Great question. A few standard tools are used, usually by geriatricians, primary care physicians, or physical therapists. One of the most widely used is the Timed Up and Go test, or TUG. The patient stands from a chair, walks 3 meters, turns around, walks back, and sits down. All while the clinician records the time.
That sounds straightforward, but really informative.
Exactly. And clinicians also measure gait speed, how quickly someone walks a set distance, because slower walking speed is strongly linked to frailty and reduced physical reserve. They also use grip strength testing with a hand dynamometer and chair rise tests, where the patient stands repeatedly from a seated position without using their arms.
How often do people go through these assessments?
Typically annually or sooner if there's a noticeable decline in strength, balance, or mobility. The goal is to catch any deficits early, before they progress further and threaten independence.
So once frailty is identified, what happens next?
Clinicians assess its severity based on criteria like reduced gait speed, muscle weakness, fatigue, unintended weight loss, and low physical activity. And the treatment approach is comprehensive. It's not just one thing.
I like that holistic framing. Can you walk us through what that looks like?
Sure. The foundation is exercise, specifically resistance and balance training to build strength, improve coordination, and restore mobility. Physical therapy plays a key role here.
And what about diet and nutrition?
Nutritional support is a major pillar. Increasing protein intake, either through dietary changes or supplementation, helps preserve muscle mass. Deficiencies in nutrients like vitamin D or vitamin B12 are also commonly corrected with targeted supplements.
Is there any medication specifically for frailty?
Not yet. There's currently no single drug approved specifically for frailty. But physicians may prescribe treatments for related conditions, like osteoporosis medications to strengthen bone, or therapies aimed at reducing chronic inflammation, which plays a role in muscle decline.
So the takeaway is really about a multi-pronged approach: exercise, nutrition, supplementation, and targeted medical care, all working together to maintain physical function and reduce the risk of falls.
Exactly. Frailty management is about preserving quality of life and long-term independence. And the earlier you identify and address it, the better the outcomes.
Well said. That's all for today. Thanks for tuning in to the Micromolar Podcast Health and Wellness Series.